Hello everyone, I'm Dr. Premalatha. I'm a consultant obstetrician and gynecologist based at Coimbatore. I work at the Royal Care Super Speciality Hospital, and today I'm going to be answering a few questions related to the menstrual cup. So let's get started. Asan cup is a sanitary product. It looks like that. It is very small. It is made of medical grade silicone. It is a reusable product that can be used for anywhere between 5 to 10 years. It is very sustainable and environmental friendly. The advantages of using this cup is it saves a lot on sanitary pads and tampons. Sanitary pads and tampons are not necessarily environmental friendly. They eventually end up in the landfills and the ocean and contribute to a lot to the environmental pollution. So we play our part to the environment by switching over to this cup. Asan cup is very easy to use. So before using, one has to ensure that she is completely relaxed. Take care of the hand hygiene by using a sanitizer or wash the hands, and then stay completely relaxed. One has to remember that the vagina is a collapsed cylinder anywhere between 9 to 11 centimeters in length, and this measuring around 4 centimeters goes easily in. It has to be folded either into a C or whichever way you like, and squatting position is ideal. So this has to be inserted into the vaginal canal. It pops open and creates a vacuum with the vaginal walls around, collects the blood from the neck of the womb, the cervix. The blood stays there. If you have a heavy flow, you can remove it in 6 to 8 hours, or if you have a moderate or a light flow, it can stay up to 12 hours. And once you pass that time, you sort of pull the ring, press a little bit here to break the vacuum, take it out, empty the cup, wash it, and it can be reused straight away. You will not feel the presence of the cup in the vagina once it is in and perfectly sealed. You can go about with your daily activities, which may even include some activities like swimming, jogging, exercise, etc. Asan cup is made of medical grade silicone. It is the same material that is used in breast implants, heart stents, etc. It is very safe to the body. It does not react with the tissues or fluid in the body. It is very inert. It absolutely doesn't hurt to use the Asan cup. One has to be aware that vagina is also called the birth canal, through which the baby's head, which is about this big, comes through. So it is very expandable. It is like a collapsed cylinder. So this Asan cup, being very small, doesn't hurt at all, and it is a very soft material. It can be easily used without causing any pain or discomfort. The cup is very unlikely to fall off the vagina because it is secured with a seal with the surrounding vaginal wall muscles. Those muscles are really very strong, and they contract and ensure that nothing falls out. So you can be convinced that the cup doesn't fall out of the vagina on its own. The cup can never get lost inside the vagina. Imagine this is the womb, and this is the cervix, which is the neck of the womb through which the menstrual blood comes, and this would be the vagina. So the cup sits in the lower part of the vagina and collects the blood from the neck of the womb. So it cannot go past the neck of the womb at all. So there is no way that the cup can get lost in the vagina. You don't have to remove the cup every time you go to the bathroom. The pelvic floor in a female has 3 openings. The front opening is for the urine to come out, and the center one is the vagina through which the menstrual blood comes out, and it is called the birth canal as well. The one in the bottom is called the anus, through which the feces come out. So you absolutely don't have to remove the cup when you have to use the toilet, whether it is to pass urine or have a bowel movement, because this is inserted into a completely different orifice. The vagina, as I mentioned before, is like a collapsed cylinder. It does have a membranous thing at the entrance which is called the hymen. The hymen already has an opening in it through which the menstrual blood passes. Yes, there is a possibility that usage of this cup can stretch it or tear it a little bit, but that doesn't equate to losing the virginity. Virginity is something to do with having a penetrative sex. This is not going to make someone do so. So it is absolutely okay and safe for a girl who hasn't been sexually active to use this cup, provided she is comfortable in using it. It would be ideal to have a working knowledge of the female anatomy before embarking on the usage of the cup. The Asan cup, being made of medical grade silicone, is very inert and doesn't react with the blood or tissues of the body. Therefore, it is very unlikely to cause infection or any other potential harm. On the other hand, the sanitary pads made of cotton and other chemicals in them can react with blood and can potentially cause infection by sitting in the damp environment with blood in them. They can cause infection either in the urinary tract or in the genital tract. So Asan cup confers an advantage over the sanitary pads in being inert, less potential for causing infections, safe to use as well. Toxic shock syndrome is a bacterial infection caused mostly due to retained tampons. As it is, it's very rare these days. Asan cup doesn't lead to toxic shock syndrome because it doesn't react with the blood, as it is made of inert medical grade silicone. But please remember not to use your Asan cup for more than 12 hours. Please remove it after 12 hours, wash it and then reuse it. Yes, the Asan cup can be very much used even if one is using an intrauterine contraceptive device. An intrauterine contraceptive device, as the name says, it sits within the cavity of the uterus and the strings of the device pops out through the cervix, which is the neck of the womb. The Asan cup sits at the bottom of the vagina, which is quite far from the neck of the womb. So it doesn't dislodge the IUCD, but to be on the safer side, it is better to check for the threats of the IUCD following insertion and removal every time to ensure that the IUCD is in its place. Just some extra caution needs to be taken whilst using it with an IUCD. That's it. Vaginismus is a condition in which the muscles of the vagina involuntarily contract when there is an attempt at any penetration, be it having sex or even putting a finger into the vagina. So, this condition is pretty common, and if you think that you could potentially have this condition, please see your gynecologist. There are treatment options available. Normally, we encourage women to go for a trial of vaginal dilators, which helps them overcome this condition. And once they overcome this condition and the fear of penetration is not there anymore, then they can go ahead and use the Asan cup. A prolapse is a condition in which the pelvic floor muscles are very weak to the point that sometimes the bladder, the uterus, or the portion of the bowel can actually drop through the vaginal walls. An Asan cup doesn't definitely cause a prolapse. Prolapse is caused due to weakening of the pelvic floor muscles, mostly caused by childbirth. And the symptoms can manifest when the women's estrogen begins to get low, that is when they near menopause. So Asan cup may not be suitable for women who already have a prolapse because the pelvic floor muscles are weak, so they may not be able to hold the cup in place, but it definitely doesn't lead to prolapse.